All right, let's talk about a procedure with a really long, kind of intimidating name. Lumbar medial branch radiofrequency ablation. But you know what? We're going to skip all the heavy jargon and get right to what you actually care about. What to expect from day 1 all the way to month 12.
I mean, this just says it all, doesn't it? When you're in pain, the last thing you want is a medical lecture. You want a calendar. You want to know what's going to happen and when. So let's build that calendar together right now. Okay, let's get the biggest question out of the way first. How long does the relief from this thing actually last? Well, the number you'll hear most often is right here. A successful procedure can give you anywhere from 6 to 12 months of relief. That's the headline.
But, you know, a number is just a number. It doesn't really tell the whole story. The real question is, what separates a fantastic result from a disappointing one? Let's dig into the key factors that can seriously stack the odds in your favor.
And that brings us to the most fundamental question of all, the one you have to answer before anything else. Is this procedure the right tool for your specific kind of pain? Because trust me, it's all about matching the solution to the problem.
So think of this RFA procedure like a very specific, specially cut key. If your pain is coming from the facet joints, these little stabilizing joints in your spine, then this key could unlock the door to some serious relief. But, and this is a big but, if your pain is coming from somewhere else, it's like trying to use that key on the wrong lock. It's just not going to work.
So let's do a quick check to see if your story fits the pattern. On the left, we've got the classic candidate. The pain is mostly in the low back or buttock area, and it really flares up when you're standing or arching your back. Sound familiar? Now look at the column on the right. This procedure is generally not for that sharp, electric, sciatica-type pain that shoots down your leg, or for more serious red flags like new weakness. Now, this is just a guide, of course, not a diagnosis, but it's a great way to see if you're even in the right ballpark.
Okay, so what if you're looking at that first column and thinking, yep, that's me. How do doctors get truly confident that you're the right person for this? Well, that brings us to what is, without a doubt, the single most important predictor of success. It's time to meet the gatekeeper.
And here it is. Medial branch blocks are the gatekeeper. Seriously, if you remember just one thing from this whole explainer, let it be this. This test is designed to protect you, to make sure you don't go through a procedure that isn't going to help you in the first place. So what is it exactly? A medial branch block is basically a test run. It is not a treatment. The doctor uses a numbing agent, an anesthesia, to temporarily switch off the very same nerves that the RFA procedure would target. The whole point is just to see what happens. Does turning off those nerves actually turn off your pain?
The logic here is so simple and, frankly, so smart. It's like a dress rehearsal for the main event. So step 1, you get the temporary block. Step 2, your only job for the next few hours is to pay attention. Does your pain get better? And then step 3, if you get a big drop in your pain level, well, that's a fantastic sign. It strongly predicts that the main show, the RFA procedure itself, is going to be a hit.
All right, so let's say you've passed the gatekeeper test with flying colors. You're a great candidate and you're moving forward. It's time to get back to that calendar we promised and really unpack the day-by-day, week-by-week timeline of what to expect.
Okay, the number one thing to remember is that relief is not a light switch. For the first couple of days, you're going to be sore right where they did the procedure, and that's totally normal. Think of it as a quiet runway. It's a time for rest, not for testing things out. Then, around day 10 to 14, that's when a lot of people start to feel that first real signal of improvement. But, and this is key, to really judge the final result, you gotta be patient. Give it until week 2, maybe even week 4, to know for sure how well it worked.
And this brings us to the biggest mental trap people fall into. You feel that soreness for the first few days, and your brain immediately jumps to, oh no, it didn't work. But that soreness is just temporary noise from the procedure itself. It is not the final signal. You have to be patient and let that noise fade so you can hear the real result. So, you've waited it out, the soreness is gone, and you're feeling that relief. Awesome. But now the game totally changes. Your focus shifts from just recovering to being strategic. How do you protect this low pain period and make it last as long as humanly possible?
This is so important. The RFA procedure buys you a good window. It's a window of opportunity where your pain is dialed way down. But what you do during that window of time, that's what determines the real return on your investment. Is this just a temporary break, or is it your chance to really change things for the long haul?
So let's talk about the common traps, the things that can slam that window shut way too early. First, going way too hard way too soon.
Another one is getting obsessed with a number on a pain scale instead of celebrating real-life wins, like being able to walk through the grocery store. But the biggest mistake of all, thinking you're fixed and just going right back to the old habits that got you here in the first place, instead of using this amazing pain-free time to build a stronger, more resilient body.
So how do you use this window like a pro? You focus on the fundamentals. You work on things like core endurance and hip control to take the stress off your low back. And I love this rule of thumb. When you're getting back into activity, you can increase how long you do something or how hard you do it, but never ever increase both at the same time. It's about being smart and strategic.
Okay, we have covered a ton of ground here, from getting the right diagnosis to making your relief last. But what's the one thing you can do right now, before you even talk to your doctor, that can make all the difference? It's simple, and it's probably going to take you about 15 minutes to set up.
Here it is. Start a simple 7-day pain log. That's it. Just track 3 simple things. What things seem to trigger your pain, what positions make it feel better, and how long can you walk or stand before the pain really starts to ramp up. You see, this isn't just random data. This is your story. It turns a vague complaint like, "my back hurts," into a crystal clear roadmap for your doctor. And it's the absolute best way to make sure that you get the right key for the right lock.